Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and I'm a PT assistant. Today, I am interviewing Rick Olderman, who is a physical therapist, on different back pain questions that our audience had for him. We are going to talk about things like sciatica, stenosis, disc herniations, and many more. So, without further ado, here is Rick. So, the next question is rather long, so bear with me, audience. I have a large L5-S1 disc herniation, so that's the low back. Since this time, my lower to mid back above the herniation feels tight and weird if I bend. So I'm guessing they mean flexing forward. Then I had a microdiscectomy surgery and no pain, but still a tightness above the herniation area. I have since re-herniated it, and I try not to bend much, but my lower to mid back still feels tight. Any ideas to what may help or what causes it, and what should I do to strengthen it to maintain being pain-free?
Okay, so this is very common, especially with back surgeries, is yes, it's going to solve that microdiscectomy or whatever, but if you don't solve the forces acting on the spine, then you're going to just get the same result, some months or maybe a year or two later after the surgery, because you haven't solved the reasons why that disc was damaged in the first place. So when I hear of tightness in the low back, usually that means that it's tight in an arched position like this. And so this plays into that same diagnosis of an extension problem. Extension just means the back is too arched, or there are too many forces trying to pull it into an arch. So what I would say, and so folks, just to orient you, this lowest vertebrae right here is L5. So they had the discectomy where that L5 meets the sacrum here. All right. So what they're saying is everything above there is tight. Well, that's normal because where the sacrum is a relatively immovable area of the body. So the spine is a relatively movable area of the body. So this junction where there's an immovable area against a movable area, that area will always have more motion attributed to it because it is the first guy in the line of attack to get motion to happen in the spine. All the others will then follow suit, but the L5-S1 that's why it's the most common area of the spine to break down and have problems. It just goes through transitioning from a motion area to a non-motion area. And you can also see it's a curve going one way into a curve going the opposite way. So whenever you have transitions of curves, you have mechanical stress. So that means that you have to be even more critical of how you're using your body to protect these changes in curvature in the spine in areas of mechanical stress. All right, so let's go back to this gentleman. So I'm going to guess that the tightness that they're experiencing here, these muscles have become very tight. And so what he's telling us is that he's afraid to bend forward. And bending forward then causes him to experience that tightness. All right. So my guess is because he's afraid to bend forward and he doesn't like that tightness, he's going to keep his back locked in this arch position as he's bending forward. Well, that's what we're all kind of taught when we go to a gym or when we go to any ergonomics trainings or anything like that is, oh, never allow your back to flex. But that is absolutely incorrect because it's the flexion that's going to help solve a lot of that pain. If you're only locked here, right, and you bend forward like this, well, what vertebra are you only moving from? If everything is locked, the only vertebra that you can move from is that L5-S1 junction. That's the only thing that you're allowing to move, and that's why it's getting broken down. So what you'll have to generally learn to do is learn how to control the flexion of your spine from all of the vertebrae. Allow them all to bend a little bit, and that will take stress off of the L5-S1 junction. Okay, so to do that, one of the things that I have people do is I have them stand at their dresser, all right, and I'm going to put that down. And let's say we open up the top drawer of our dresser. You put your hands on the top drawer, and what you do is you allow yourself to slump into this motion here. So we're not hinging from the hips. We're not doing this. We're rounding like this, all right? And you're holding on here so you can support your trunk, because if you've never done this before, you don't know how to control your spine. And so for this person in particular, this should feel really good to allow that to happen. All right. And once they get good at that, then they can close that drawer and open up the next one and learn how to flex their spine a little bit lower and so on down the dresser. And then they walk themselves back up the dresser too until they can learn how to control that. So what you've got to do is gradually teach the spine to flex a little bit at a time at each vertebral level to disperse that force rather than just having all of that force happen at that one junction at the L5S1. And then the other thing, ultimately, I'm going to bet that this person has tight thigh muscles because the tight thigh muscles are tilting the pelvis forward and locking it into this arch, which means that anytime that person bends and that pelvis is locked forward, it's going to cause the L5S1 to move even more. So stretching the thigh muscles would also be a big one. But ultimately, you'll have to learn to flex from all the spine. Now, of course, if you're lifting, 100 pounds and heavy loads, you don't want to flex your spine while doing that. But if you're picking a sock up off the floor, you by all means need to learn how to flex your spine to do little jobs like that. And you need to learn how to use your legs to lift that sock instead of using your back. So, I'll go into this again, I'll back up here. When people bend down, and for instance, this gentleman, I can only imagine that when he bends down, he's trying to do this to pick up something and keeping that back lock. Well, he's only perpetuating the pattern that's causing the pain. Instead, you need to stagger your stance, put the load on the first leg, and then you can have your hand on your thigh if you want to, and slowly flex your spine and put all your weight on that first leg to bend down to pick something up and use the leg to come back up. So then that's just using your leg to pick things up instead of your back to pick things up like this. All right. Where for lighter loads, that's absolutely the correct way to do things. So a lot of stuff there. Hopefully that answers this question.
All right. Well, thank you for joining us again. Where can people find more information about you at?
If they go to rickolderman.com, I have lots of free stuff there. I have some blogs. I have all my home programs, my practitioner training program, and there's a contact form there, of course, for me that you can use to reach out if you like.
Okay, perfect. Well, thank you for joining us.
My pleasure, Mike. Thanks for having me.